Hi everyone, my name is Gille Peplau, and I am referred to as the mother of psychiatric nursing. I was born September 1st, 1909, and in 1918 I witnessed a flu epidemic that came through the area which I lived, and that really sparked my interest in nursing. So in 1931, I graduated from Pottstown, Pennsylvania School of Nursing. In 1943, I worked with the Army Nurse Corps with leading psychiatric practitioners to help develop treatments for men returning from war with disorders such as post-traumatic stress. In 1946, I began obtaining my master's and doctoral degrees in nursing, which I completed in 1950. Then in 1952, I published my theory, Interpersonal Relations in Nursing. Throughout the 1950s to the 1970s, I developed and taught various psychiatric nursing programs, both in the U.S. and in the U.K. From the 1970s to the 80s, I served as an advisor to many professional organizations like the American Nurses Association, and I also worked closely with the U.S. Surgeon General. Finally, in 1991, I published Interpersonal Relations in Nursing, a conceptual framework of reference for psychodynamic nursing. This was a collection of works that I had previously written but never published. My theory of interpersonal relations is a mid-range nursing theory. It's narrower in the scope of study, and it's used to guide evidence and research-based practice. It is also referred to as psychodynamic nursing and focuses on being able to understand one's own behavior to help others identify felt difficulties and to apply principles of human relations to the problems that arise at all levels of practice. This allows for collaboration between the nurse and the patient to result in increased quality of care. My theory has 4 phases. The first phase is the orientation phase, in which the patient has realized that they have a problem and seeks help. The nurse and the patient meet as strangers, and the patient and the nurse discuss unique difficulties and needs. The identification phase is where the nurse and the patient establish expectations of the other and identify appropriate routes of care. They also define their goals and outcomes in this phase. The third phase, the exploitation phase, is when the nurse provides resources to assist the patient. They also help to balance the level of independence, which you want to be increasing as this phase goes along, and the patient will utilize the professional services recommended. Lastly is the resolution phase, where patients' needs have been met by collaboration between the nurse and themselves, and the termination of the professional relationship is seen here. In describing a theory, there are 4 working parts. My theory focuses specifically on person, environment, health, and nursing. The person, which is described as an individual, is an organism that lives in an unstable equilibrium, and it strives in its own way to reduce tension generated by needs. The environment, which can be inferred that the environment consists of existing forces outside of the organism and in the context of culture. Health is a word symbol that implies forward movement of personality and other ongoing human processes in the direction of creative, constructive, productive, personal, and community living. And lastly, nursing is a therapeutic interpersonal process because it involves the interaction between 2 or more individuals who have a common goal. For individuals who are sick and in need of health care, it's a healing art. Now, my theory has been applied in many different settings, but for the purpose of today's presentation, I'd like to focus on the emergency setting. The interactions in the emergency room are typically shorter and occur during an urgent or traumatic situation. It is essential for the emergency nurse to communicate proactively with the patients and their families, utilizing empathy, assertiveness, and active listening. In this particular case, a woman had entered the emergency room unable to breathe. She was seeking help, which starts the orientation phase. The triage nurse offers assistance and empathy, which builds the trusting relationship between her and the patient. The next step allows the nurse to assess the patient, to learn the valuable information that's going to tell her about her history, to explain the patient's condition. The nurse in this case learns that the patient is intoxicated, had recently lost her job, and was quite anxious and breathing heavily, though her pulse ox was stable. So they use this to recognize that the behaviors indicate that she is having a panic attack and possibly struggling a little bit with dealing with her personal life. So the patient recognizes this and utilizes resources given by the nurse to make outpatient appointments that can help deal with her anxiety and panic attacks. Termination is seen in this case when discharge instructions are given and they're reviewed with the patient. The patient leaves the hospital. Here you can see the patient's achieved a level of independence, maybe not full independence yet, but they are able to start the process with another nurse at another facility to continue their care. In current practice, my theory is utilized every day. I specifically had a patient who wanted to make herself a do not resuscitate, and she wanted my opinion in the matter. I had to look internally and examine my own thoughts before that I could help her or talk to her about making this decision. I had asked her what her situation was and her condition that was leading to the decision. Once she had told me, I had offered resources to the patient, such as palliative care and pastoral care, hospice, and she began to request to speak with these particular services on her own. Once she had met with each, she became more independent. She did end up going through with her decision and was discharged to her assisted living facility. We also gave her some community support resources, but you can see where there's her seeking help, which shows the orientation phase. The working phase, or the identification phase, is where she identifies her problem and her condition. The working phase is where we get her those resources. And then lastly, the termination, where she is given the discharge instructions and leaves the facility. So the way that we talk to people and communicate people can really hinder or encourage people to seek healthcare treatment, which oftentimes people have bad experiences, so they don't want to go back. So really try to use that in your own practice, and hopefully it will help people's experiences a little bit more, make it easier for us as nurses to treat patients. I'd like to just end with this statement. Somewhere, somehow, at some time in the past, courageous nurses have determined these skills, learned them, fought for the right to use them, refined them, and taught them to other nurses. All nurses have an obligation to remember that part of nursing's past and to keep their own skills on pace with new opportunities for nursing into the next century. Thank you so much for your time.